5 pilot ministries will sign MOUs with the Ministry of Women's Affairs to deliver on specific outcomes and outputs for women. For doing this, they will get additional budgetary resources. For instance, one example of that is collaboration between the Ministry of Agriculture and the Ministry of Communications Technologies to get 5 million phones into the hands of women for multiple purposes. 1, to improve their access to health services. 2, to improve their access to inputs, agricultural inputs, and to give them a platform on which all types of services that benefit women and children can be built on. The Ministry of Health, under this program, will also implement initiatives to support women's reproductive health. They plan to provide health and hope to 1/3 of the pool of young girls and women who have been waiting for a long time for VVF repairs by providing surgery and economic rehabilitation, and I salute them for it. Let me take a moment to just again thank our midwives who have already been recognized many times. We want to say that without them and without their dedication and their beautiful commitment shown in their singing, we would be very far away from where we want to be. So thank you, my dear sisters. In conclusion, Nigeria is on the verge of a very important transformation. In fact, it's not on the verge, it is transforming. Nigeria can reap its demographic dividend by focused investment in human capital development, such as in health and education. The Saving 1 Million Lives initiative, which all of you are here as partners, both private sector, public sector, religious organizations, development partners, the United Nations, all of us. The initiative we're here today to launch is a laudable step in unlocking this demographic dividend that I've spoken about for our country. And with that, I say thank you all for being here with us.
Thank you very much. Your Excellencies, very distinguished ladies and gentlemen, it's now time to listen to the remarks of His Excellency Prime Minister and co-chair of the UN Commission, Prime Minister of Norway, ably represented today by Angel Hansen, Secretary General and representative of the Prime Minister. Your Excellency.
President Jonathan, distinguished members of Parliament, ministers, excellencies, dear friends committed to saving the lives of women and children. It's a great pleasure and honor for me to be here today. This meeting marks an important step in the process of translating the recommendations of the UN Commission on life-saving commodities for women and children into action. As you know, the Commission chairs President Jonathan and Prime Minister Stoltenberg recently met in New York to present the Commission's report to the UN Secretary General. Unfortunately, Prime Minister Stoltenberg was unable to come to Abuja today because of the budget debate in the Norwegian Parliament presently taking place. However, he has asked me to deliver this speech on his behalf and to warmly greet you all. Mr. President, let me begin by thanking Nigeria for the excellent cooperation we have enjoyed while co-chairing the Commission on Life-Saving Commodities and in the field of maternal and child health more generally. In New York, we presented a report setting out 10 bold recommendations. We have identified 13 life-saving commodities that could save millions of lives effectively and with a low price tag. Now we need to ensure that these life-saving commodities reach those who need them most urgently. What we also did in New York, and this is quite unique at such an early stage, was to present a detailed implementation plan. Furthermore, a large group of stakeholders have agreed to contribute to this effort, and we have already secured funding to fill the gaps. A special trust fund will be set up for this purpose and administered by UNICEF and UNFPA. In New York, we agreed to take stock in 6 months' time to assess our progress. I look forward to seeing the results of our combined efforts. I would like to give special words of appreciation to you, President Jonathan, for the commitment and the leadership you have shown in engaging other African leaders, including at the AU Summit in July. We welcome your initiatives to improve maternal and child health. These initiatives set an example for other countries to follow. Let me add that investing in women's and children's health, and thus in women's empowerment, not only produces rewarding results for individuals, but can also lead to increased prosperity for an entire nation. Norway is a good example of this. 100 years ago, Norway was among Europe's poorest countries. We now are among the most prosperous, and that is not due to petroleum. One of the main reasons for our progress is that we have succeeded in mobilizing all our human resources and putting them to good use. Since the early 1970s, women have doubled the pool of human resources in our workforce. Women have created new jobs and generated tax revenue, enabling us to continue to invest in welfare and opportunities for all. I believe the key political lesson is this: strengthening women's empowerment is one way to make a high return investment in better health, not only for women themselves, but also for their families and for society at large. Through your many initiatives, President Jonathan, you are taking a similar approach. Let me mention some of the commitments you have made, bearing testimony to your strong leadership. You have endorsed the UN Secretary General's Global Strategy for Women and Children's Health and are committed to increasing Nigeria's budgetary allocation to health by as much as 15%. At the London Family Planning Summit in July, you committed to achieving the goal of increasing the contraceptive prevalence rate substantially by 2018. The Save 1 Million Lives initiative seeks to drastically reduce child mortality in Nigeria by 2015. Through the National Scale-Up Plan for Essential Medicine, you aim to reach an 80% coverage level for recommended treatments for childhood diarrhea, pneumonia, and malaria by 2015. Through your policies, you will scale up the use of 2 of the life-saving commodities recommended by the Commission, zinc and oral rehydration salts, used in the treatment of diarrhea. You will also, together with the Clinton Health Access Initiative, take the lead on implementing the Commission's recommendations for these 2 products. We are pleased to note that you are working on implementing mobile health, or mHealth as it is known. Mobile phone applications have the potential to help health workers share essential information with mothers and their families. They can also be used to help in the distribution of these life-saving commodities. From the perspective of the Commission, the most important task is the implementation of its recommendations. Nigeria's endeavours are an example of this. There are also representatives from other countries, organizations and stakeholders present here today who will do their part in helping us to achieve our common goal, to stop the preventable deaths of millions of mothers and children by ensuring that they get the right medicines at the right time. Norway is also pleased to be cooperating with Nigeria on achieving Millennium Development Goals 4 and 5. Together with the United Kingdom, we are supporting a successful program to reduce maternal and child mortality in 4 states in northern Nigeria. Major achievements have been made which have had a positive impact on maternal and newborn health. The 2011 midterm household survey indicated that births supervised by skilled birth attendants have doubled and infant mortality has halved since the program started. In spite of the huge challenges that the northern region is facing, the program is performing well. I'm pleased to announce today that as part of our continued collaboration with Nigeria, we will commit, subject to parliamentary approval, $25 million over 5 years in support of your Save 1 Million Lives initiative, Mr. President. And in particular to support your work to promote the use of oral rehydration salts and zinc as well as mobile health. I would like to finish by wishing you every success with the important work that you are taking on here today. Our recommendations can save the lives of over 6 million women and children over the next 5 years. I am confident that by working together, we can succeed. Now it's up to us to put our words into action. There is no time to lose. I thank you.
Thank you very much. I would please once again appreciate the effort of the Norwegian government to ensure that this new initiative will indeed work for Nigeria. Please let's put our hands together once more. Your Excellency, we are there. In Nigeria, we'll say we don't reach. Okay. I'd like to present to you a man who believes in strengthening women, a man who believes in gender equality and has demonstrated that, a wonderful husband and a father, His Excellency, the President of the Federal Republic of Nigeria and co-chair of the UN Commission on Life-Saving Commodities for Women and Children,
Thank you. Please be seated. Today, when I walked in here and I looked and saw the galaxy of people and the various interest groups represented, I felt very highly elated as a person, and I feel new things are happening in this country, new things are happening in the world. So today I will crave indulgence to bore your ears a little, because I will go a little more by recognizing so many, not recognizing but appreciating so many people that ordinarily ought not to do that as a president just making a simple speech. Because whenever it comes to the issue of saving lives of women and children, I feel very passionate because my mother gave birth to 9 of us, but only me and my elder sister are alive. 7 of my siblings died as infants. And sometimes when I remember their faces as infants, I knew they would have grown up as very pretty young ladies and handsome men. But today, myself and my elder sister, that I'm alive today is a chance factor controlled by the hand of God. It's not by any human intervention. So as a person, I'm quite passionate about anything government is doing or corporate bodies or humanitarian organizations are doing that will help to save life of children and women. Probably I'm even luckier. Some people of my nature even lose their mothers and they grew up to be orphans. So what we are doing today is I'm quite pleased. And for that reason, really, I have to sincerely thank my good friend, the Prime Minister of Norway, that today sends the Secretary General, Banto Angel Hansen, to represent him. Thank you for coming and thank you for your generous contribution. We believe your Parliament will approve it. Let me especially appreciate the Chairman of the Senate Committee on Health and the Chairman of the House of Representatives Committee on Health that are here with us, because they will be able to carry what they have observed, what they have listened to the Parliament. Parliaments are very, very strong bodies. That's why the Secretary General told us the Norway Prime Minister couldn't come because of the debate going on about their budget. And of course, in Nigeria also, you have been reading in the papers about the debate. Let me appreciate the ministers from Nigeria and other countries are here in this gathering, members of our diplomatic corps and our development partners. Let me sincerely thank you. In our flood situation, you have made commitment to assist us, just like also made commitment that they will assist in terms of flood. In fact, Nigeria is so devastated by the flood. Sometimes when you just watch television, you may not appreciate what people are going through. I traveled from the north to the south. On Sunday, I was in my village after touring my state. I left my village on Sunday morning, as at that time, the flood was just about entering my compound. As at this morning, the information I got is that all my windows are underwater. So you can see what people are passing through within this period. But the assistance the development partners will give us, and people who are in the humanitarian sector surely will get over it. Let me sincerely appreciate our religious leader, the president of CAN is here, Pastor Ayor Sajefo, and other traditional rulers. They are key in terms of some of our health issues. Because in terms of polio, we are still battling because of some cultural limitations. And those people who can break the jinx whenever it comes to cultural issues are the religious and the traditional leaders. So we are grateful that you are here with us and you carry that message to others. Let me appreciate the co-vice chair for being with us today. Other development partners, Chelsea Clinton, we thank you for being here. And let me use this opportunity to thank what the Clinton family has been doing for the world, for Africa, and especially Nigeria. We are grateful that you're here with us. And Jimovia, representing the private sector in Nigeria, especially the Nigerian Private Sector Health Alliance. The private sector in Nigeria really is doing very well, cooperating with government in so many ways at the economic front. I'm quite pleased to see him, and we've listened to him. They will bring the private sector perspective into managing whatever we get, and they've been doing wonderfully well. Even in terms of this flood disaster that we have, they are playing a robust role, and I believe they will bring a lot of financial assistance and, of course, managing the finances and make sure that we cushion the effect of this flood on our people. And the United Nations Commissioners on the life-saving commodities, we interacted in New York, and let me thank you for those of you who are here, and everybody that was able to come here for this program, our midwives, the state governors represented by the Director General of the Nigerian Governors Forum, and all other humanitarian organizations, whether they are here or not, but they are totally committed to this issue of saving children and women. So today is a special day as we mark another milestone in the global effort to protect the rights of women and children to survive and thrive whilst enjoying improved access to essential life-saving commodities. This auspicious occasion affords me the opportunity to formally launch Nigeria's Save 1 Million Lives program in line with the United Nations Global Strategy for Women's and Children Health Agenda, which aims at saving 16 million lives by 2015. Of course, 2015 is the year that my tenure of 4 years will end. So we have to work very hard so that we have good stories to talk about that 2015 date. Last month in New York, Prime Minister Jens Stoltenberg of Norway and myself submitted the final report of the United Nations Commission on Life-Saving Commodities for Women and Children to the Secretary General of the United Nations as co-chairs of the Commission. The report highlights the recommended actions and next steps for increasing access to life-saving commodities and their appropriate use, which can save the lives of millions of women and children around the world by 2015. At a high-level meeting in New York, I shared with world leaders our country's commitment to saving lives as the ultimate goal and yardstick for measuring our success in the health sector. Consistent with the Human Capital Development pillar of our administration's transformation agenda, we have initiated the Saving 1 Million Lives program. Our objective is to save 1 million lives by 2015 through equitable and increased access to and utilization of quality, cost-effective basic health services. The program clearly identifies the need for increased access and to the appropriate use of essential medicines, medical devices, and other commodities that save lives. The government and people of Nigeria greatly appreciate the support of our development partners for ongoing efforts by relevant government ministries, departments, and agencies in this regard. On behalf of my co-chair, Prime Minister Jens Stoltenberg of Norway, I thank the co-vice chairs of the Commission, Mr. Tony Leke, Executive Director of the United Nations Children's Fund, and our own Professor Babatunde Osetime, Executive Director of the United Nations Fund for Population Activities. I also thank all the distinguished commissioners, co-conveners, and technical agencies for all their support for this program. Increased domestic funding for commodities is a key area of commitment we are pursuing in this administration. We are committed to a total of $33.4 million over the next 4 years for the procurement of additional quantities of reproductive health commodities, representing a 300% domestic funding increase. Of course, with the pledge of the Prime Minister of Norway, we are almost doubling this figure. We have also ring-fenced $500 million over the next 4 years for maternal, newborn, and child health interventions under the Subsidy Reinvestment and Empowerment Program. This money, about $500 million, we are getting from just like the Commodities Minister said, when we reduce the subsidy on hydrocarbons, on the petroleum products, we'll make some savings. And I feel that these savings we have to use in intervening in areas that will touch the life of everybody. And one key thing is health, especially as relating to women and children. And of course, general intervention on our roads using a number of young men and women that probably have no job, so that we touch the life of so many people, and also these activities impact on our population. This is in addition to increased commitment of $68 million US made to the polio and routine immunization programs. We'll talk about the polio later. In an effort to improve financial access to life-saving commodities for women and children, particularly the vulnerable population, the federal government of Nigeria in April 2011 removed user fees for contraceptives in public health facilities. This has led to a dramatic increase in demand for contraceptives in the public sector by more than 150%. With support from our partners, we have developed an essential childhood medicines scale-up plan addressing diarrhea, malaria, and pneumonia, three diseases which account for 55% of our nation's under 5 deaths. Achieving 80% treatment coverage for all children with this effective treatment will translate to saving more than 500,000 lives. Today, I am happy to note that Nigeria, alongside the other participating Every Woman, Every Child movement countries, have now finalized individual country implementation plans that take into account the Commission's 10 recommendations and 13 identified life-saving commodities. I urge all national governments to ensure the implementation of these plans, which target specific recommendations and commodities that will have the most impact on the vulnerable segments of our respective populations. Nigeria's country implementation plan has taken into account our specific local context and prioritized a number of commodities in such a way that it builds on our ongoing efforts and future aspirations. Distinguished ladies and gentlemen, it is now my singular honor and pleasure to formally launch the Save 1 Million Lives program, which reaffirms our government's commitment to enhance access to life-saving commodities for women and children and to improve our health outcomes. This is important for our country and the rest of the world if we are to reap the demographic dividends that will ensure that in the years to come, Nigeria is free from such health challenges. Today is also an important day because immediately I live here and probably immediately the program ends because the Minister of State for Health who coordinates these issues will be with me. We're also meeting with governors and local government chairmen from states that we still have a polio, because we are going to discuss, and because some of you will not, or most of you will not be there, I can leak out information that I will tell them. What I have for the governors and the chairman is that myself, the vice president, the coordinating minister of the economy, the health minister, and the minister of state for health, and all the governors, the local government chairmen, the traditional rulers, religious leaders from these local governments that are still warehousing polio will not sleep until we eradicate polio. For the governors are probably maybe too busy to come for the meeting today. Myself being the #1 messenger of the country, I will move with my team to their states to discuss with them and go to the local government and discuss with the leaders, because there's no reason, there's no justifiable reason at all for Nigeria to still have polio. No reason. The lives of our women and children are important assets for our country. We shall do everything in our powers to safeguard them. This is a collective task we must complete in order to save the world. We must save our women. We must save our children. I thank you.
Once again, Mr. President, on behalf of Nigerian children, I want to say thank you for this move to kick polio out of Nigeria. We continue with this program, and I must say that this is an exciting moment for me, because if Mr. President is going to move around the country and go to the endemic areas, then it means we must together support this move and ensure that our mothers and our children live healthy lives, and besides that, kick polio out of Nigeria. At this point, Your Excellencies, let me invite a very wonderful woman and one of the Amazons of Administration, the Permanent Secretary, Federal Ministry of Health, Mrs. Fatima Bamidele, to move the vote of thanks.
Your Excellency, Dr. Goodluck Ebele Jonathan, GCFR, President of the Federal Republic of Nigeria, Your Excellency, Mr. Jørgen Stoltenberg, Prime Minister of Norway, ably represented by Ms. Hansen, the distinguished Chairman, Senate Committee on Health, and the Honorable Chairman, House Committee on Health. I also recognize the former Minister of Health, Professor Babatunde Oshotimehin, the DG UNFPA, and also the Deputy Executive Director of UNICEF. I warmly welcome Ms. Clinton, and at this juncture, Mr. President, I'd like to crave your indulgence to stand on the other established protocols. Before I start my vote of thanks, I would like to specially thank Mr. President for making my job very easy, because I believe he had thanked almost everyone. So if I leave some people out, just refer to Mr. President and forgive me. It is my honor and privilege to give the vote of thanks on the combined activities of the Technical and Ministerial Implementation Meeting of the United Nations Commission on Life-Saving Commodities for Women and Children, as well as the launching of the Nigerian Saving 1 Million Lives program. First of all, I'd like to thank the Almighty God for making everyone here present to see the light of today in its goodness. Without God, none of this would have been possible. We also thank Him for making the meeting a huge success. We appreciate most sincerely His Excellency, Dr. Goodluck Ebele Jonathan, GCFR, the President of the Federal Republic of Nigeria, in his distinguished capacity as co-chair of the United Nations Commission on Life-Saving Commodities for Women and Children. We especially thank Mr. President for his leadership and conduct of business of this meeting and the launching of the Nigerian Saving 1 Million Lives program, as well as seeing them to logical and successful end. This program, when fully actualized through a new approach of upscaling various health interventionist programs and projects, will no doubt accelerate basic services delivery and bring about improvements in the Nigerian health outcomes. It would also enhance the present administration's transformation agenda in the health sector. We also appreciate His Excellency, the Prime Minister of Norway, ably represented by Ms. Hansen, who is also the Permanent Secretary of Norwegian Foreign Affairs, for being co-chairs of the United Nations Commission on Life-Saving Commodities for Women and Children. Our special thanks goes to the Governors Forum, ably represented by the DG and the various governors of the various states here present. We must and do appreciate the presence of the senators and the honorable members of the House, represented by the chairs of Senate Committee on Health and House Committee on Health. The Honorable Ministers of Health, Professor Sio Onyebuchi-Chukwu, and the Honorable Minister of State for Health, and all other ministers from Nigeria and outside Nigeria are greatly appreciated. We appreciate and thank the co-vice chairs of the Commission, under the Under-Secretary Generals, Mr. Tony Lake, who is ably represented by the Executive Director, and Professor Babatunde Oshotimenyu for their worldwide effort and all their technical support. We acknowledge and appreciate the presence of all various dignitaries, diplomatic corps, our development partners, WHO, UNICEF, UNESCO, UNFPA, and the representative of the Nigerian Private Sector Health Alliance, who have been with us every step of the way. We thank most especially our religious leaders, traditional leaders who also play important roles in moving the health sector forward. Distinguished ladies and gentlemen, I'd also like to thank the press most sincerely, because without the press, they will not be able to propagate a lot of the things that we say and do here and bring it to the general populace. To all other important dignitaries, too numerous to mention, I salute you for gracing this occasion. I'd also like to recognize the Secretariat staff, members of the Security Corps, the logistics managers, the great people behind the scene who put this event together. Finally, I'd like to appreciate the midwives. When they were singing their songs, I almost had tears in my eyes. So I salute them and all the other health workers who we all represent, and we're here because of them today. And I hope when we go to CAPAM, we'll be able to come back with the award and make Nigeria proud. Finally, I would like to thank my sister, the moderator. This is the first time I'm seeing her with butterflies in her tummy. Once more, I thank you all, and I wish you journey mercies back to your various destinations. Thank you.
Thank you very much. A couple of announcements before we round up this morning, or this afternoon rather. There'll be a guided tour of exhibition stands, and the dignitaries, the co-chairs, co-vice chairs, the UN commissioners and ministers from participating countries only are invited for this guided tour of exhibition. The rest of us will remain in this hall, and there'll be a tea break, and the ushers will let you know where the tea break will hold. At the international press briefing that will be held immediately after the guide moment, in spite of the butterflies, they've all disappeared now, so I'm free. Thank you all for your time, and please watch NTA all the time. Shall we have the national anthem?